Hi, my name is Huma Malik, and today we're going to talk about what is leukemia and what causes its side effects. So, leukemia is a blood cancer that begins in the bone marrow when a DNA mutation occurs in a single cell, which then starts to divide and spread uncontrollably. This results in mutated cells filling the bone marrow, which results in disrupting healthy cells. According to leukemia specialist Curtis Lashowitz at OHSU, the mutation alters the genetic blueprint, preventing the cell from dying as it should, leading to cells that essentially never die. So, how is leukemia categorized? Leukemia has two main types, acute and chronic. It is further classified into myeloid or lymphocytic leukemia, depending on whether the myeloid or the lymphoid cells were affected. The most common types are chronic myeloid leukemia, CML, chronic lymphocytic leukemia, CLL, acute myeloid leukemia, AML, and acute lymphoblastic leukemia, ALL. Now, what is the percentage of people who get leukemia in the US, and how common is it? Who is at risk? So, leukemia is the 10th most common cancer in the US, accounting for 3.2% of new cases according to Cleveland Clinic. It is more common in white individuals, those aged 65 plus, and those assigned male at birth. Genetics may play a role, with about 10% of cases being inherited, though it's not guaranteed, as Curtis Lashowitz states. What are the factors that increase the chances of leukemia? Dr. Faiza, a clinical analyst, explains that there is no single cause of leukemia as each type varies, but common factors include genetic mutations, radiation, chemotherapy history, chemical exposure like benzene, and genetic conditions like Down syndrome. Moving on to what treatments are used for leukemia and what are the side effects. All treatments are unique and one does not fit all, but deciding to go for treatment may have some side effects that patients should be aware of beforehand and keep watch of post-treatment. Side effects may include symptoms that are long-term like organ damage, fertility issues, and secondary cancers, and short-term like hair loss and fungal infections. So common treatment side effects are vomiting, nausea, increased risk of infection, frequent infections, nail discoloration, electrolyte imbalance, fungal mouth sores, easy bruising and bleeding, fatigue, anemia, fever, and loss of appetite. For the treatments, they mainly include chemotherapy, targeted therapy, radiation and immunotherapy, monoclonal antibody treatment, and bone marrow and stem cell transplant. Now on to what are the symptoms of each common category of leukemia. AML and ALL share similar symptoms as both cause irregular blood cell counts, leading to anemia and a high risk of life-threatening infections. In contrast, chronic leukemias like CLL and CML usually have no symptoms initially and can be managed with a healthy lifestyle and medication. If symptoms appear, they develop gradually over time, often due to an accumulation of mutated cells intercepting the functioning of healthy cells over time or an underlying disease. Now, moving on, there are some symptoms to look out for on the skin, such as bruises and leukemia cutis happening commonly on the face, but can also happen all around the body and can come in forms such as macules, papules, blisters, skin lesions, and ulcers. Symptoms such as bleeding, pale skin, swollen lymph nodes, and acquiring petechae or purpura, which are small red-purple patches looking like a rash, may also occur. And some symptoms like Sweet syndrome and mastocytosis range in forms varying from flat lesions to inflamed nodules are also possible symptoms. Next, we'll talk about which leukemia type has the highest and lowest survival rates. So, CLL has the highest 5-year survival rate, while AML has the lowest, according to Cleveland Clinic. When interviewing Curtis Lashowitz, he acknowledged that AML has the lowest survival rate out of the 4 main categories because it is aggressive, unlike CLL, which is gradual. Also, because people usually 65 and above are getting AML, comorbid diseases are already prevalent, which then complicates treatment. Because of these factors, aggressive chemotherapy is highly intolerable, which makes recovery dramatically slower. Also, while CLL has a homogeneous mutation that can be killed by targeted therapy, AML has various mutations in one body, which may need multiple different treatments. Lastly, how can we help? So, firstly, we can express patience and compassion to those who have leukemia. Be respectful of these decisions. Do not compare their lives with others. What we feel as encouragement could be disheartening. Make sure to reassure them, validate their feelings, and offer them support. And last but not least, donate to cancer facilities and research foundations. And thank you so much for hearing this presentation.